right, so we're here with our next patient. Her name's Hind, and she's here for a full face rejuvenation treatment. I think this one will be a really good case because we've got a lot of opportunities for structural treatments and rejuvenation along the way. So Hind's 35, her heritage, her ethnicity is Middle Eastern. And so we're going to systematically look through the different treatment zones and see how we can address Hind's aesthetic concerns. So let's dive into that first of all. So welcome to clinic.
Thank you.
How are you?
Very well, thank you.
Good. Thank you for joining us today. So can you talk us through in your own words the main concerns that you have?
Yeah. So I just want to look more rejuvenated. My areas of concern are the temple. I've had a bit of volume loss and the midface as well.
Okay.
And also a little bit the chin. I've had it treated a couple of times, but the filler always seems to go quite quickly from there.
Okay, understood. And your lips? You had your lips treated before?
I did, yes.
Yeah. When was what was the last treatment you had?
I think I only did 0.5 mil the last time, and it was about a year ago.
About a year ago? Because I think the lips are looking good. They look quite treated. I wouldn't need additional volume there. That's my personal view, but we'll have a look. Okay, so that's the main concerns is kind of upper face and mid face, and then a little bit in the lower face, contouring the chin. I'm going to take you through what I see, and together then we can hopefully come up with a really good treatment plan. So as always, we're starting in the upper face, and I can also see from this side view as well. I'm quite happy with the curvature to the forehead. We do have some volume loss in the temples, and if we replace volume here, we're going to start to see an improvement to the periorbital area. It's going to also improve the midface. I see a very classical area of volume loss in the midface. This flattening in the anterior cheek is where we lose some of the deep support, the soothe and the deep medial cheek fat in the midface is where we start to get some flattening. And I think that will be a really nice opportunity to create some youthful volume in the anterior cheek. Continuing that into the under eye, I think the tear trough in this case is a really good treatment target. We can sort of see these shadows under the eye, and that's in this case is due to volume. The reason I say that is because if you close your eye for me and I press here, we do have a little bit of bulging of the intraorbital fat, but there's also a very clear volumetric change as well. And so I can address that with filler. I'm quite confident in that. Moving through further in the midface, I see a shadow here, and this nasolabial fold happens due to the laxity of the tissues and movement of the fat pads, but we also have some volume loss at the maxilla, and I think addressing the maxilla with some volume in the piriform space will be a very effective treatment. So that's how I would structure my mid-face and upper face treatment. Moving into the lower face, so I think this is really where we see a real opportunity. I think that the bizygomatic distance is very wide. The bigonial distance is relatively narrow. And in this case, we can afford to really create some structure here in the lower face. I want to widen this here because I think it will balance the face. And then in addition to that, I'm going to then try and continue the jawline all the way through to the chin. On profile, I think she's a very good profile balance between the upper face, the nose, and the lower face and the lips. I don't need to add any additional support or structure to those zones. So this is why I would call this a full face treatment, where we're going to address all of those different zones. And we're going to be using the Revanesse range of fillers today. Does that sound good?
That sounds amazing, thank you.
All right, so let's get a headband on and let's get started. Sorry to interrupt this video. Hi, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I'm the one doing the injection that you're watching right now. I just want to take a moment to talk about our injectables diploma. So Harley Academy is a higher education college for aesthetic medicine based out of the centre of London, UK. And over 3,000 medical professionals have gone through our academic programs to achieve a postgraduate diploma in aesthetics. They will get a title after their name, PG Dip Aesthetics. If you want to learn more about our programs, how you can gain your qualification and learn how to inject in a really structured, systematic and evidence-based way, then click on the details below and our team will be happy to have a conversation with you. Right, that's enough from me. Let's get back to the video. But if you are enjoying this and you want to see more content like this, please subscribe and click like. Now let's do our marking up. So I'm going to mark up on this side and then I'm going to treat on that side. So you can see the markings as I go through the treatment. Let's start off in the temples. Remember our principles. We're going to start deep, work superficial. We're going to start cranial and work our way caudal. And we're starting laterally and working our way medially. So when I come up with a treatment plan, I'm going to always follow those principles to get the best results. So here I've marked out the temporal fossa. And in this case, she's very suitable for a supraperiosteal bolus technique. The reason is I'd like to try and create some elevation to the tail of the brow. And because I see a particularly deep volumetric target that I want to address with my filler. If there was a more diffuse area of volume loss, then we could consider a cannula technique. In this case, following our supraperiosteal guidelines, 1 centimeter along the temporal crest and another centimeter down into the temple, that gives us our injection point for the temporal fossa. So this is how we're going to do that injection. Once we've done that, I expect that we're going to get a little bit of a lift to the tail of the brow, which will be very aesthetic already on its own. We have this beautiful cheekbone, and I don't recommend we need to do anything to enhance the cheekbone because we've already got very good projection here. But like I said, we do have this really amazing target, which is the medial SUF. And so we're going to look at how we can add some anterior volume to this. Let's just remind ourselves of the fat pad targets in the midface. So we find the lower inferior border of the bony orbit. This becomes our uppermost margin of our midface treatments. So that there is a reference point for our orbicularis retaining ligament. Then we'll find the iris, and the medial limbus of the iris is where we have the zygomatic ligament coming off here. So this will be our zygomatic cutaneous ligament. And between these two, we have our suborbicularis oculi fat, and beyond this zygomatic ligament, here's where we have the tear trough itself. And so my injection target is in the SUF today, and this is a really good opportunity to treat that with a cannula. So I'm going to create some volume in the suborbicularis oculi fat at the cheek apex. This there would be where I'd like to create maximal projection in this patient. And then following that, I can continue my cannula treatment and I can treat the tear trough itself. I don't want to treat underneath the zygomatic cutaneous ligament in the deep medial cheek fat, because if you give me a really big smile, okay, we've already got this good central volume, and I don't think that she will benefit from any deep structural support. I think the volume we're looking for in this case is the SUF. If these anatomical targets are a little bit confusing, then we can go through that in a lot more detail in our other videos and within the GEM library. So you can have a look at that separately. Here we also have the bony target, which is our deep piriform space. This one is a good target because I do feel like we have some maxillary recession, and I'm going to be using a needle again down onto bone to try and create some projection here. So I'm deliberately missing out this area, both in the subcutaneous plane, but also deep down onto bone, because when I look at the patient from an oblique angle, this is not where I want to create anterior projection. It's more at the apex of the cheek, and it's more down at the piriform fossa. So that's how I would sequence my mid-face treatment. Let's start with that in the temples. So let's just run through some principles for this temple technique with a needle. Remember, in the temple, we have 10 different layers in the temple. And when we're injecting with a needle, it's going down onto bone. But where this filler ends up going is actually inside the muscle, the temporalis muscle. And that's important because the muscle is sitting right on top of bone. We have to inject with a needle at a 45-degree angle, because if we inject perpendicular like this, the filler will track back up the needle and it can end up in the superficial plane. Whereas if we inject at a 45-degree angle, the filler will stay underneath the deep temporal fascia. And the deep temporal fascia is the ceiling of where I want this filler to sit within the temple. In terms of blood vessels, we've got the superficial temporal artery. And the superficial temporal artery actually is running within layer 3. So if we have this ascending up the lateral midface from the external carotid artery, this superficial temporal artery is running just underneath the skin inside layer 3. I'm not so worried about that one. However, deep within the temple, we have the deep anterior and deep posterior temporal arteries. And the concern we have with deep injections is that in the deep anterior temporal artery, there is an anastomosis with the internal carotid circulation. And that anastomosis is sometimes called the zygomatico-temporal artery. That one does connect with the ophthalmic artery and therefore has a theoretical risk of visual loss with treatments like a deep temple filler. And so that's why we have to be very careful with our injection technique to minimize the risk of such a complication, which would be extraordinarily rare. And that's following the landmark that we have here. The reason this is an effective landmark, 1 up, 1 over, is because it finds the most superficial aspect of where the bone is to skin when the needle touches down on bone. But there's something else we can do, which is we can also aspirate. And that is also going to help us get more comfortable with the idea that we're not inside a vessel. Some injectors are also using an ultrasound machine to scan for the deep temporal arteries. So palpating for the superficial temporal artery, I can feel it here. It's not within my injection plane. It's more posterior. I find my target and I touch down onto bone. So that really didn't have to go very far because Hind has got very low subcutaneous fat. I'm confident this is down onto bone and I'm at a 45-degree angle and I'm going to have a really good 10-second aspiration. So now I'm going to slowly inject, keeping this 45-degree angle and staying nicely down onto bone. Sometimes a little air bubble like that makes a little clicking noise. Can startle the patient when it's perfectly normal. All the while I'm injecting, I'm looking for skin discoloration, I'm looking for blanching, I'm looking for any pain. Comfortable? Yeah, good. So now we just continue slow injection. The filler is then spreading down at this deep layer and it's being prevented from tracking superficially by the deep temporal fascia, which will allow the filler to spread. Like you can see it spreading further down here now as well. Okay, slowly remove. That's it. That little click is the needle moving out through the different layers of the temple. But you can see here, okay, no bleeding, no bruising. I do like to put 10 seconds of gentle pressure here just to help prevent any deep hematomas that may have formed that you wouldn't be able to see if it because it's so deep. And what I want to do is just have a look in the camera so we can see if there's been a change already to the position of this eyebrow compared to this one. So if you just sit forwards and look in the camera. Lovely. Chin up a little. There. Okay, so I wonder if you can notice here that this tail here is just ever so slightly lifted. The apex of the brow is a little bit higher on this side. And that's starting to create a more youthful aesthetic appearance to the periorbital area. So head back. Brilliant. Now let's move on to the midface. So we're using a product now that's a little softer, Rejuvenation Contour. And I'm going to be targeting this suborbicularis oculi fat pad. And then I'm going to be moving through to using Rejuvenation Revise to treat the tear trough itself. So I'm just going to mark on where I want this apex of the cheek to live. Again, it's this intersection between this lateral bony orbit here. I'd like to draw a vertical line down here. And this will vary depending on masculine or feminine preferences. But this is where I tend to find the point of most projection that I want to achieve. And I'm going to make an entry point that allows me to treat this apex and also continue into the tear trough. So it's going to come in this direction. And then let's go through the different layers that I'm targeting. So we're going to go through the dermis into the subcutaneous depth, okay? But we don't want to put the filler in this depth. This is too superficial. We need to move underneath the orbicularis oculi muscle. So a little push and a little pop. There. And now this is the depth that we can start to add some volume to create this new apex of the cheek. This is the boundary between the medial and the lateral tooth, but it's a really important target. Note that we could have gone deeper. There's another depth we can go into, which would be the pre-periosteal fat. But in a younger patient who's quite slim, if we treat in the tooth, we're going to get the most volume, the most surface change for the volume that we're injecting. So this is a really good target. So that's 0.3 mils on the apex of the cheek. And that alone is a very powerful injection. There was a study that showed this tooth has got the highest surface volume coefficient, which means that for every 0.1 mil that you inject, you almost get a entirely corresponding change to the aesthetic appearance of the surface. So this is what we're starting to build here, this beautiful defined apex. Let me take off the markings on this side now, and then we can start to compare like for like. Just look upwards. Thank you. Okay, so hopefully you can appreciate the structure that's starting to emerge. We're going to now continue into the tear trough itself before treating the piriform fossa. So now we're moving to the under eye using a much softer product, Reviness Revised. I want you to look upwards for me. And we're going to, again, track into the plane beneath the muscle. So a little pop there. Very gentle, subtle pop there. And now we're in the tear trough. From here, you can see where my cannula is. All right. This is behind the muscle. And I'm doing little micro droplets. I suspect a very small amount here is needed to create a really good correction under the eye. With this treatment, I'm not creating thick threads of filler. I'm using little micro droplets with the product to create as much of an even looking and smooth result, whilst also reducing the risk of any edema. So this is just 0.2 mils of under eye filler, so very, very small amounts. But if I sit you forward now, hopefully you can appreciate the improvement to that side of the under eye. Final treatment on this side of the midface is going to be an injection down at the piriform fossa. This one is going to give support to the entirety of the midface. With this one, it's important that we very definitely touch down onto bone and aspirate. We're injecting in a potential space that exists medial to the deep medial cheek fat. a little scratch. Well done. So down onto bone. This is an injection down onto the maxilla, and I'm going to aspirate again, like with the temple, a good 10 seconds, because this is one where we have a very unpredictable course of the arterial supply. And now let's slowly inject. The maxilla here is recessing with aging. We have bony resorption. And so if we can support the maxilla, then it will reduce the appearance of nasolabial folds, and it will also increase the angle of the maxilla so that all the tissues that are being supported by the receding maxilla or having loss of support will regain that support. Whilst I'm injecting, I'm always watching the nose. I'm always watching the skin of the nose, which is the course of the angular artery, making sure that we have good capillary refill on the side wall of the nose. So that's less than 2 seconds, which is great. We have the infraorbital nerve that traverses over this area, and this means that the upper lip can become numb once we've injected the piriform fossa with filler, because the filler contains some lidocaine. How was that? Is it okay? Bit stingy, that one. You did great. So look, we've treated the temple, we've treated the apex of the cheek, we've treated the tear trough and the piriform fossa. If I sit you forwards now, I hope we can appreciate in the camera the, first of all, the really nice projected shape on this side, but also the support of the maxilla and also the improvement in the under eye and the temple as well. So I'm going to continue now on this side. I'm going to start to structure the lower face, and we'll see if we can start to continue to add more shape to the face. What we learnt in aesthetic medicine even 1 or 2 years ago is now outdated. Why? Because aesthetics is still a relatively new science, and the research underpinning our work, particularly our understanding of anatomy, has advanced significantly. Hello, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I want to introduce you to GEM, the Global Evidence Matrix. GEM is a dynamic, evidence-based framework that gives injectors a clear, consistent guide for safe, effective treatments, all grounded in science, not in corporate sales pitches. GEM combines clinical research, anatomical knowledge, and injector expertise, and it's always updated with the latest evidence. Think of GEM as your interactive map for facial aesthetics, guiding you through every step from technique to product choice. With GEM, you're not just injecting, you're working at the forefront of medical aesthetics. Join us in setting a new standard for safety and results. So the first injection we're going to do is to create some structure at the corner of the jaw. And I'm doing this, if you remember, to try and improve the bigonial width. So I can be quite generous here. I'm going to use 0.5 ml of filler. And then I'm going to also treat this entire area with a cannula in the subcutaneous plane to add even more structure and definition. This injection down onto the bone here passes usually just through the skin, the parotidomastoteric fascia, the parotid muscle itself, and then down onto bone. It's unlikely to pass through the parotid gland, but in an aging patient, you may notice that the parotid gland extends over this point that you're trying to inject. So from here, I'm using my fingers to make sure that we've got a nice boundary for where the filler can go. And I'm going to inject half of my product. Providing we've avoided the major vessels that exist posterior to the gonial angle, this injection is a relatively safe zone for vascular risk. Comfortable?
And now you're in a safe position doing a single bolus. You've done your aspiration there, negative aspirate, rather than moving around lots and doing smaller injections where you're hunting around for a vessel. This feels safer.
Perfect. So we've done an injection, a deep injection. Now we're going to move to some subcutaneous shaping. And if you turn this way a little, I can see a little way in which the jawline goes inwards and then back outwards. And my objective now is to try and continue the jawline directly straight all the way through to this nice new projected corner of the jaw. So I'm going to move with an access point just here. And so then the second half of my product can be used in layer 2. Making sure to fan products over the mandibular border as well as on the front of it, so that we don't have this little indentation underneath the border of the mandible. We can fan all the way over the top of the masseter muscle like this, staying in the subcutaneous depth like this. For me now, when I look at this jawline, it's very balanced in line with the width of the cheekbones. If we have a look in the camera, if you sit forwards again, looking up there, beautiful. Right. So hopefully you can appreciate now how much harmony we have compared to this side, where we don't have this structure in the lower corner of the face, whereas on this side, really started to create that definition. And when we look at the width of the cheekbones here, we have the width here, whereas this side is more narrow. So this starts to then create more of a sense of balance to the face. So if you smile, big smile, look into the camera, breathe with your teeth. Yeah. I wonder if you can also appreciate here that because of the support that we've created in the mid and the lower face, the corner of the mouth can lift higher. We've got better functional movement of the lip elevators as well. So a really big smile, if you can. Yeah. So we can see further back through the teeth as these lip elevators are starting to elevate better. And that's owing to a more support and more structure through the filler injections. Final injection is going to be in the chin. So this is the entry point for the chin. And my objective here is to just try and smooth some of the transitions. I'm not trying to create more chin projection. I'm trying to inject on top of the muscle so that the muscle can relax. It can reduce its insertion and attachment to the skin. And this will just reduce what Hind is complaining about, which is some of the dimpling in the chin. And we do that by simply detaching the chin muscle, the mentalis, from the skin. Worth mentioning that when we start to detach the muscle from the skin like this, it can just lead to some bruising. It doesn't mean that we've clipped a major vessel. It just means that we've started to separate those layers, because in this part of the face, we have a different skin formation, and the skin is very tightly adherent to the underlying muscle and the subcutaneous fat. So we can separate it like this while it's fanning into the labiomental crease, into the pre-jowl area, and into the marionette area as well. And I like to use a relatively soft product here, Reviness Ultra, because anything stiff will actually find it's quite difficult to inject into this really narrow compartment, which is just subdermally with a cannula. So this has been 0.6 mils injected. And with that, I am done. That's what I wanted to do with the chin. And I'm going to treat this entire side off camera and then we'll review the whole face. But I just want to take a look in the camera now to see the results. And I think, as expected, the main benefit that I notice here is the improvement to the apex of the cheek here, but then also the structure that has been created all the way from the jawline down to the chin on this side compared to this side. All right, so let's rest you back and then we'll be back with the final result. All right, so now let's take a look at the finished result. So this is Hind after our full face treatment. I'm going to talk you through the treatments and examine different zones. So first of all, we did the temple supraperiosteal bolus. That's a stage 2 technique. Then we moved on to the anterior cheek, this treating the sooth with a cannula. That's a stage 2 technique. And the tear trough itself, I treated underneath the muscle. That's a stage 2 technique. So all of this is a intermediate level injection. And I hope you can appreciate the beautiful projection here, the very smooth transitions from the eyelid to the cheek and the support to the temples and the tails of the brow. We then treated the piriform fossa with a needle. Okay, that's a stage 1 and stage 2 technique. And then moving into the lower face, gonial angle and connecting it through to the jawline. I think this has been really quite striking in terms of the bigonial width. The width of the jawline and the width of the cheekbones are now correlated to create this really beautiful feminine lower face, all the way through to a final treatment of treating in the subdermal plane in the chin, not to create more shape and structure, but more to soften the muscle activity and to really help with this continuous, beautiful jawline all the way through to the chin. So all in all, a full face sequence. Can we have a look in the mirror? Let me see what our patient thinks. So tell us, what do you see?
Oh, it looks amazing. Thank you so much.
So what's the thing you noticed the most?
Definitely here. Oh, no, and the chin as well. It's just so much more balanced.
Yeah? Good.
I think it was quite narrow before, but now it feels...
The lower face is balanced. Yeah. Turn this way, back into the camera. All right, cool. Thank you very much, everyone. Look forward to seeing you next time.